Hello everyone, we are the student of Ashok Ramani Institute of Pharmaceutical Science and Research VII. Today we are conducting a seminar on drug distribution system in a hospital. This seminar presented by Rupali Rawla, Vaishnavi Neje, Monica Pawar, Aradhna Kamble, Anuj Gaikwad and Ayan Mujawar. This seminar is guided by respected Mr. A.N. Dagesar. So let's see content in this topic. First, definition. Second, method of drug distribution for inpatients. Third, charging policy. Fourth, content of label. Fifth, dispensing of drug to ambulatory patient. Sixth, types. Seventh, dispensing of controlled drug. Definition. It is the physical transfer of drug from the storage area in the hospital to the patient bedside. Method of drug distribution for inpatients. There are four systems for dispensing drug for inpatients. First, individual prescription order system. Second, complete floor stock system. Third, combination of first and second. Fourth, the unit dose method. First, individual prescription order system. The physician writes the prescription for an individual patient who obtain the drug from any medical store or hospital dispensary by paying own charges. Advantages. First, it provides the interaction of pharmacist, doctor, nurse and the patients. Second, medication orders are directly reviewed by the pharmacist. Second, complete floor stock system. Drugs are stored at the nursing station and are administered by a nurse according to the chart order of the physician. Only commonly used drugs are stocked on the floor. Advantages. First, reduced inpatient prescription order. Second, minimum returns of the drugs. Third, the drugs are readily available for administration. Charge floor stock drugs. Those medications that are stocked on the nursing station and are directly charged to the patient accounts. Non-charge floor stock drugs. Those medications that are stocked at the nursing station for use of all patients in the wards. No direct charge on the patient accounts. Third, combination of individual prescription order system and complete floor stock system. The combination system is the most commonly used in hospitals nowadays and is modified to include the use of the individual prescription order medication order system as the primary means of dispensing. Utilize a limited floor stock. Fourth, unit dose system. Those medications which are ordered, packaged, handled, administered, and charged in multiple of single dose unit. Supply sufficient for one regular dose application or use. Advantages. A. The patient receives the pharmaceutical service 24 hours a day and is charged for only drugs which are administered to them. B. All doses of medication are required at the nursing station, which allows the nurse more time for the direct patient care. C. To reduce the medication error allows the pharmacist to check a copy of the physician's original order. D. Promote more efficiency utilization of professional and non-professional personnel. E. Unit dose dispensing procedure. A single unit package is one which contains one complete pharmaceutical dosage from and is stored in a central and pharmacy and also dispensed at the time. Charging policy. The hospital should have a uniform schedule for charging of drugs. Unequitable price for drugs should be charged to all categories of patients and it should be kept in mind to protect the hospital financial interest. This policy can be categorized under several systems like first, all inclusive or no special rate. Charge for about 250 patients are studied. Their average daily charge for drugs and pharmaceutical service is calculated. Second, a part inclusive rate. Charges are made for drugs not on the free list or supplied list. Third, the professional fee concept. The inclusive professional fee to meet all operating expenses, including overhead and compensation, but not the actual cost of drug and containers. 4. Break-even point pricing. It is overall analysis of cost-value relationship. It is defined as the level at which there is neither profit nor loss. Fifth, a cost plus rate system. It is helps in adjustment of cost fluctuation, differences in currency value, financial requirements, and offers fairness to both hospital and patients. 6. The profit aspect. In this, profit is calculated into price to the patients by a fixed fee per prescription. 7th, computerized pricing. Provide a computerized online pharmacy pricing. The following information is included. First, patient number. Second, drug identification number. Third, dose factor. Fourth, total number of dose dispensed. Contents of label. First, name of the drug. Second, dosage form. Third, strength. Fourth, batch number. Fifth, expiry date. Sixth, special direction if required. First, name. The name of the drug should be written in such a way that it should be legible and prominent. Second, dosage form. The dosage form and route of administration should appear on the label. Example, injection. Third, strength. Strength of the drug should be given both in metric system and whole numbers. Fourth, batch number. It should be written along with manufacturer's name and address. Fifth, expiry date. The period should always be mentioned on the label. Sixth, special direction. Like shake will before use, for external use only, not to chewed, etc. This should be written as a special note on the label. Dispensing of drug to ambulatory patient. Ambulatory patients are those who are not occupy bed in a hospital but utilize the service of the hospital. The ambulatory patient get themselves registration at the registration counter of that hospital. The various steps involved in the dispensing are: first, after registration, the patients are directed to a particular department. Second, the physician diagnoses the disease and writes a prescription along with the medication schedule. Third, the patient produces the same prescription before the pharmacist in the pharmacy. Fourth, pharmacist should take every precaution to minimize the error. Fifth, in case pharmacist need any clarification about the prescription, he should contact the physician without the knowledge of the patient. Sixth, if medicines are liquid to poured as the tablet or capsule to be counted. Seventh, the compounded prescription is filled in a container and labeled with the detailed instruction. 8. The container is given to the patient so that the same can produced by him during the next visit. 9. The emergency cases of the hospitals may be issued medicine immediately. Types. First, emergency outpatient. A person give dispensing at the emergency or accidental case or condition who has seen or pursued emergency. Second, primary care. All the patients other than emergency who report directly to the OPD. It is a majority case. Third, referral patient. A person referred to an OPD by his attending medical or dental practitioner for specific diagnostic or treatment procedure. Dispensing of controlled drugs. In large hospitals, dangerous drugs like opium derivatives, morphines, and belladonna, etc., are included for various purposes. To control the use of this drug, Narcotic and Psychotropic Substance Act 1985 was passed, and such drugs are entered in Schedule X of Drug and Cosmetic Act 1940. A separate register should be maintained to record them and control the procedure is used to issue or receive the drugs. Medical superintendent is overall responsible for handling of controlled drugs. Hospital pharmacist procure, store, and responsible for proper dispensing of drug. Prescription for narcotic drugs must include the proper information like patient full name, address, date, name and strength of the drug, quality of drugs, signature of prescribed dose, and route of administration. The prescription signed by a registered medical practitioner will also permit the patient to purchase the drug from outside the pharmacy. Charges for narcotic drugs from the pharmacy depends upon the policy of the hospital. Nurses on duty count physical narcotics on each nursing station to check the records. Nurse should always maintain a proper record in case wastage or contamination.